How to correct a crooked nose. When we talk about a crooked nose, the problem is not only the septum. The bones are also deviated, the septal cartilages are deviated, and very often the tip cartilages are asymmetric as well. So if you correct only the septum, you do not automatically correct the whole nose. There is another important nuance. Sometimes the septum is not severely bent in shape. It is simply tilted or shifted to one side. In that situation, the goal is not always to cut it aggressively or rebuild it completely. Sometimes it is more correct to move it into a new central position and use it as a main support of the nose. That is why surgery starts long before the operation itself. First, the nose has to be analyzed very carefully by CT scan and ultrasound. CT scan helps to understand the bony framework and deeper anatomy. And ultrasound helps evaluate the soft tissues and cartilage. After that, a 3D model can be created, and if necessary, the future surgery can be planned in detail. During surgery, the key step is to mobilize the osteocartilaginous pyramid, the structure we see externally as the dorsum, the hump, and the main framework of the nose. Then the septum becomes the central reference point, almost like the main support wall of the nose. We reposition the septum and then align the other nasal structures around it. After that, the septum is fixed in its new position. At the same time, if there are septal spurs, crests, or irregularities of the bone and dorsal cartilages, those are also corrected. Then we move to the tip. The tip cartilages also have to be straightened, balanced, and stabilized. And one final point. If the septum is too deformed to be repositioned and has to be completely rebuilt, then a structural reconstructive rhinoplasty is usually needed. It is a different situation, and it is more complex with a higher chance of small asymmetries or irregularities during healing.